Okay, sorry if I look kind of haggard. I've been kind of laying on my bed, shifting my position a bit. I want to talk to you about a common problem for people on the autism spectrum, and it has to do with intestinal issues, digestive issues. I'm one of those people that gets them from time to time. It's pretty much colic, and I'm actually starting to have an attack right now. My way of fighting it is to take an ibuprofen as soon as I feel the bloating start, because it starts at my stomach, and it's random. There's nothing that actually causes it, although being lactose intolerant, I know things that can bring on an attack, but sometimes I just have them, and it's perfectly normal. I've had them all my life. I apologize for my lazy eye. I'm having a hard time focusing. But taking ibuprofen right away kind of helps the pain, because I guess it helps with the same receptors that are activated with period cramps, because it works. But I don't get these attacks as often now since I started eating lactose-free yogurt. I don't know if that has something to do with it or what, but I ate some yogurt because I was having an unrelated stomach issue, and I just noticed that I had less gas and stuff. Because from day to day I would have a lot, like I would feel it in there all the time, and now I really don't have it as much. But I still do get the colic attacks, and I'm kind of having one. So I just kind of wanted to share what I do when I'm having one to kind of minimize the pain until the bubble moves or breaks up or whatever. For one thing, being so skinny means that, that's the floor, I'm not farting. Being really skinny means everything is really compact inside, so, I have to worry about my vagus nerve too, because when I get a lot of pressure on it, I can get dizzy and kind of pass out. So when I'm having this colic, I try not to get up and walk too much unless I'm sure it's not pressing on anything. But one position I commonly use when this is happening, and I'm actually going to have to use it, I'm not going to do it to show, I'm going to actually do it to do, is to get on my hands and knees. Because when I'm vertical, I guess all of my intestines are just kind of squished together, on my pelvis, and all the organs underneath, kidneys, bladder, well, kidneys are in your back, bladder, uterus, whatever, adrenal glands, muscles, and the peritoneal sac, or whatever they call it, all the stuff holding it up. And so when I get horizontal, it's like it opens everything. So it's like my intestines are just hanging there. They're just hanging there instead of all squished. They're just kind of, I don't know how to explain it. I just know that it works. So I get like this. I don't know how well you can see, but I get on my hands and knees, and I just kind of have to deal with it, wait for it to pass. But I'm going to put the camera down here and look down at it. Sorry if this is a freakish angle, but I don't want my arms to get tired. Sorry. Okay, fine. Here, you can just fall, whatever. But parents, if you have children and they seem to have like meltdowns for no particular reason, you might want to ask them if they have a tummy ache. And you could talk to your doctor about like abdominal massages. I don't like those personally, but they might work for your child. Sorry, my ability to talk is starting to kind of go. And if it's safe to do so, give them Gas-X or Beano. And if they tolerate yogurt, give them the lactose-free kind, because I'm pretty sure that anything with the lactose in it, lactulose, whatever they call it, You know, if your child is lactose intolerant, that might upset their stomach more. I'm lactose intolerant myself. I can drink milk, I can eat ice cream, I can eat cheese, no problem, but food like cottage cheese and regular yogurt and milkshakes will make me violently ill. Like, out the backside, violently ill. Like, I don't even want to describe how disgustingly ill I get, but it is very, very, very bad. And it's very painful, too. You know, it's more painful than just a regular gas colic attack like this. It's really bad now. I'm trying to breathe deep, but it keeps taking my breath away. I don't want to compare this to childbirth because I've never given birth and that wouldn't be fair, but it is. It's actually worse than once a month cramps, actually, this. But I don't get this as often. I used to have it like once or twice a week, and now I might only get it once every other month because I've started eating yogurt. I don't know what it is about yogurt, but I just know that the yogurt has changed something for the better. It's funny, I really do like yogurt, actually. I discovered that. Yogurt's like the first, like, fruity snack I've ever eaten that actually tastes like the fruit it's made to be. And I mean, you know, there's only 3 flavors for lactose free. There's the French vanilla, the strawberry, and the peach. I'm talking to distract myself. You know, they're actually made with the fruit, so it actually tastes like it. It's not like ice cream where it's just kind of vaguely flavored like a fruit. You know what fruit it is. I can open a yogurt and smell it or taste it and know exactly what flavor it is. Most of the time. You know, my dad, he eats the Activia, so that's got different flavors, and I like to open them and smell them just to see if I can guess the flavor. But I don't eat them because they're not lactose free and they make me sick. I tried the spoonful one once and I had gas all day. It was horrible. Not like colic gas, just I was a fart machine all day and it was ridiculous. I really apologize if I look hideous at this angle, but it is moving. It is starting to move. I'll be able to get up in a minute or two. Ow. Yeah, hit your choir bag with your hand. That's good. I'm making more of a mess of my hair. I don't care. I'll brush it later. Again. The key for me is to just keep breathing, because when I don't breathe, it makes my body tense up, and when I tense up, it hurts. You know, being a singer has taught me how to breathe very deeply, which I am very grateful for. Because to sing, you breathe in and you move your diaphragm down, so you feel like everything in your stomach is being pushed down, and that helps push the stuff down. It's not like pushing to go to the bathroom. It's a different kind of a push. I don't know how to explain it. I just do it all the time. When I need to take a deep breath, I don't just inflate my chest. I inflate my stomach. Although it's a little bit hard to do it in this position. I have to be straight up and down for it to really work, but that hurts. This really hurts too. Oh my god. Oh. It's stuck on my left side. Okay, I've got to get lower. Gas moves up, right? So, again, sorry if this is a really scary, freaky angle. It's almost over. It's almost past. I'm surprised I was able to talk through all that. I guess that's because I'm not talking to a person. I'm talking to a camera. And so I'm not having to receive, I can only send info. It's moving now. I can feel it. I can hear it. I don't know if you can, but I can. It's like this weird... It's like somebody's blowing bubbles under my skin in my stomach. Oh, there it goes. It just moved. Oh. The relief when it moves is freaking amazing. And then it's going to get stuck on my right side. I'm going to have to do this all over again. But, you know, I wanted to share this aspect of the autism spectrum with you because, you know, parents, you might have children who have this and they might be screaming and you might not know why, and this might be a reason. You know, I have had these attacks in public and they're not fun because then I do have to get down on the ground in public. That's, you know, I've not had to in front of people I know, thankfully. But I do remember one time I had to be on the ground at Walmart and I didn't want to be in the restroom, so I went into a changing room and did it. And it was just really embarrassing. That's the story. There's really nothing more to the story other than I was on my hands and knees on the floor in a changing room at Walmart one time because my stomach was hurting so bad. I'm sorry if I just blew air on the mic. I'm just trying to relax because here comes wave 2. So I'm going to close this, but I wanted to share this just to kind of bring some awareness. So anyway, it's fine, it's normal. I don't need a doctor or an ER. I just have to wait it out. You know, it's kind of like periods. They happen. It's just one of those things, you know. Just live with it. You deal with it, and you go on.